Yeah,
You
welcome.
admitted everybody? Yeah, okay. Well, yes, welcome everyone. We're glad to have you here today. I'm Donna Enfield, the Behavioral Health Consultant at Indian Health Service, the Bemidji area office. And we are partnering with the University of Iowa. Very pleased to bring you today a presentation with Dr. Avis Garcia. Walking in Two Worlds, Behavioral Health Challenges of Living Native in a Native World. And this particular topic, substance use disorder and domestic violence. Steve, do you want to say hello, and then we'll turn it over to Avis to get started?
Well, yes, thank you so much, Donna. It's great to be with you and everyone else this morning. I want to welcome you here to our, I can't believe this, but this is our 5th installment. Already we're moving through our planned schedule, so it's amazing how we're already in December. I want to welcome everyone. Good morning or good afternoon, depending on where this broadcast finds you. My name is Steve Steiny. I'm with the Native Center for Behavioral Health here at the University of Iowa. We are happy to be partnering with Donna Enfield through IHS, the Bemidji area, and really happy to be with all of you this morning. We've got a great presenter today who will be providing some information on 2 very important topics that are intertwined in a lot of ways, and we'll talk about that and hopefully have a little time for some discussion and interaction towards the end of today's presentation. But want to just say good morning to everyone. I guess if it's afternoon, it's afternoon somewhere, I would imagine, but I guess we are probably a good chance everyone is in the morning here. So I will say good morning. I have a few intro slides that I'll go through. I know we're going to try and keep folks muted during the presentation, but we should have a time to allow you to unmute and ask some questions directly to Avis if we have a chance to do so. And I have Jeff Ladolter, a colleague of mine, on the line as well from our Native Center for Behavioral Health. He and I will be monitoring the chat box and trying to field questions as they come in. So Donna, again, I want to thank you for partnering with us on this really important webinar series. So let's go through the intro slides, and then I'm going to turn the floor over to Dr. Garcia so we can have this discussion. And I'll have to have a few minutes to transition, pulling these slides down, and pulling the PowerPoint up. So bear with me as we do that. As most of you may know, this project is supported by the Native Center for Behavioral Health in the University of Iowa. The content is developed by the presenter, and the opinions expressed today do not necessarily reflect the views of the Native Center for Behavioral Health, the University of Iowa, or the Bemidji Indian Health Services. Let's see if I can have my screen in the way here. So there we go. Following today's event, we will send you a link to these slides, most likely in a PDF format. So we will be able to share these slide presentations with you. And we also are recording this event, so we can make a link available to you to view this discussion at a later time, or share it with a colleague who perhaps was not able to join us today. And lastly, we will be offering 1.5 NADAC approved CEUs. If you are interested in CEUs, either for NADAC or for social work, you can indicate your request for those at the time that you receive the follow-up email, and we will get those out to you electronically. So we're happy to be able to provide those CEUs to the group today. I know we're gathered here virtually today, but I want to take a few moments to acknowledge the land and pay respect to the indigenous nations whose homelands were forcibly taken and inhabited. Please take a moment to read this land acknowledgement, which was created by 3 members of our team, Ella and Keely Driscoll, and our co-director, Mr. Sean Mayer. Thank you. Well, without further ado, I would like to introduce my colleague and my friend, Avis Garcia. She is an enrolled member of the Northern Arapaho tribe and is affiliated with the Eastern Shoshone tribes of the Wind River Reservation in Wyoming. She has many, many years of experience. I think you mentioned over 20 years, Avis, how time flies when you're helping people. She is a LPC and an addictions therapist. She holds her doctorate in counselor education and supervision with a specialty in substance use disorders and working with Native Americans. Avis works with individuals of all ages, individuals, groups, couples, and family therapy. And she also specializes in treatment of substance use disorders and trauma. Really happy to have her as part of our consultant team and part of our advisory council, and really happy to have her here today to go over some really important information. So I want to turn the floor over to her. I'm going to just pull this screen down and get her PowerPoint up. I want to remind everyone that you are muted today, but we'll have a chance towards the end, hopefully, for some questions or comments, and you can unmute and interact directly with the group. So for now, just remain muted so we can focus our attention on the topic at hand. I'm going to pull this screen down, everyone, so bear with me. And let's see if I can share the next screen. I better make sure I can get that information up. Oh, wonderful technology. Let's see. Okay, I've got it, Avis. I'm just going to get this shared with the rest of you. And you guys let me know if I get this adjusted to presentation mode. How does that look for everyone? You guys see the full screen there? Great, I'm getting a thumbs up from Teresa. Thank you so much. Okay, Avis, I will turn the floor over to you. Again, I want to welcome everyone to our webinar today, Substance Use Disorders and Domestic Violence. Avis, great to see you, and you have the floor.
All righty. Good morning, everyone. Thank you for taking time out of your schedule this morning to be here to listen to the presentation where I will be discussing domestic violence and substance use disorders. I've given presentations on domestic violence quite a bit throughout my career, and this is the first time I've actually been asked to put more emphasis on how substance use is involved in domestic violence. This is a challenging subject to present. It is something that affects Indian country all over. I've talked to many, many people in different places, and even my friends and family back home on the Wind River Reservation. And almost everyone that I've encountered has experienced domestic violence on some level. Several of my own family members, myself included. Also, I was trying to think how many years ago it was, but I lost my mother to domestic violence. So this has been a very important topic for me throughout my career. It's what drew me to the counseling profession and the substance abuse profession, is wanting to help people. I decided to use, my experience of what I went through to help others to get out of the situation, or if they get out, to help them to get themselves healed and healthy and you know, break those cycles. I like to think that I broke the cycle in my family by getting myself out of situations like that in the past. And I've been an advocate. Shortly after I lost my mother, I did become a domestic violence advocate in Rock Springs, Wyoming. And I had a lot of experience of seeing women leave and thinking I got them out of there and watching them go back. And it was never told to me to do self-care at that time. Now there's this huge movement towards self-care. So I like to preface this presentation in particular to everyone to practice some self-care after today, because sometimes it does bring up some hard feelings and some uncomfortable feelings. So make sure you do something special for yourself today. That's very important. I just wanted to add that. And we can get into today's slides. Steve, go on ahead and move. First of all, what is domestic violence? It involves physical abuse, psychological abuse, sexual abuse, threats to control children, emotional abuse, financial abuse, and isolation. To the next slide. The extent and prevalence. Native Americans tend to have a much higher prevalence of domestic violence than all other races and ethnicities. These studies, though, are fraught with many flaws. The outcomes and resulting data should be viewed with extreme caution. I like to remind people that we as Natives only make up, we've actually grown in population. We used to be 1%, and I believe we're at 1.5%. So we're growing. So when you look at those numbers, our numbers always look larger than everyone else's because of our population so small. It's most limited to individual site studies. I want to tell you that research in domestic violence is hard to come by. I did more research when I was asked to do this presentation, and I was still disappointed. I was excited to get into a couple other libraries I've never had access to, only to be disappointed and continue to see that domestic violence research is very limited. So if somebody out there is thinking about doing some research or getting your master's or PhD, this is something very worthwhile studying, especially specific to Native Americans. They all have negative validity issues associated with them, such as the low number of participants and multiple recounting of incidents. Data only from domestic violence shelters and their clients, when it is well known that most victims do not even use the services. Many women are ashamed or embarrassed, or especially in Indian country, there's a whole lot more issues that they deal with than non-Native people do. A lot of times I saw this on my own reservation with women afraid because they had to go up against a whole entire family. So that creates, you know, a much more trauma to that individual. And this is a typo there, sorry, it should say other methodological issues. So go on ahead and change to the next slide. I'm catching these. The Bureau of Justice stats, back up. Okay, did you move ahead one too quick? Okay, right there.
Sorry, Avis.
Okay. American Indians and crime, the response to pressure from victim advocates and researchers searching for data on the prevalence rates among Native Americans. The first comprehensive statistical report on crime and violent victimization among Indians issued in the United States Department of Justice in 1999. Indians account, this says less than 1% of the population. About 124 incidents per 1,000 persons over the age of 12. All other races have violent victimization rate at a rate of 50 per 1,000 over the age of 12. So you can see how much higher it is in Native communities. To the next slide. Some more stats. Lower level misdemeanor acts of domestic violence on tribal lands are often not reported. The Uniform Crime Report does not capture domestic violence among Indians. Indians experience more than twice the rate of violence than the rest of the nation. And the National Crime Victims Survey used it. It's the only semi-comprehensive data source for national rates of violent victimization among Indians. So we need to do better data recording. You can go to the next slide. National Violence Against Women Survey, American Indian and Alaska Native women had significantly higher rate of rape, 34.1% higher, stalking 17% higher, and physical assault 61.4% higher than any other ethnic group. One known problem, various cultural characteristics. The numerous tribal nations are hidden. All the American Indians and Alaska Natives are grouped as one. So it's just like the rest of the country, when they talk about natives, they don't even pay attention to the unique tribes that we have, like 560, maybe 570 federally recognized tribes, different languages, different foods, different ways of living. But a lot of the research, not just on domestic violence, but all research puts us in one category. I think a year ago, we were all laughing about, we were put in a category as something else. So more tribal specific research is needed. In one Southern Ute study, poor young women were more likely to report violent victimization than any others. You go to the next slide. What is known? Little scientifically sound research is available in family violence in Native American communities and within the family. Risk factors for one woman study. Like I said, a lot of the research is far and few to find. It's really outdated. Risk factors for women, marital status, having an alcoholic parent, childhood maltreatment, and lifetime alcohol dependence. So those increases a woman's chance of being in domestic violence. Male natives who experienced lifetime alcohol dependence and childhood maltreatment were at risk for physical assault. Another similar study in 2006, again, marital status, child maltreatment, and lifetime alcohol dependence were also identified as risk factors. Go ahead to the next slide. Data collection problems. Current research tends to focus more on other minority groups. We are not minorities, we were here first. Focused on mainstream majority victims. Other predators and risk factors identified are multiple victimization experience as another risk factor for assault. So if somebody's already been in a domestic violence situation, they're more likely to be in it again. Research among Native Americans is scarce in the sociological and criminological literature, can be found in psychological and medical literatures on violent victimization. Next, please. No differences. I have concluded that based on current data that do exist, there are no differences in the rates and prevalence of domestic violence and victimization that occurs in any other similarly situated non-Indian community. So to me, it's the same everywhere. You go to the next slide. Contextual versus traditional causes. One Southern Ute survey reported their own, those of others, and some reported evil spirits and negative spiritual entities were involved in violence experienced. Another study referred to domestic violence as bad medicine, bad people, those who drink and use drugs, are those who are possessive and jealous. So when you go against your cultural ways and your life of living right, some people who have those traditional viewpoints tend to think that these types of things happen to people that aren't doing their life right, which is true, probably, for the most part. all a result of social disorganization, marginalization, and colonialism. Literature indicates a lack of attachment to culture and substance use as primary precipitators to domestic violence. Traditional cultural beliefs such as the use of witchcraft and sorcery are also believed to be responsible for domestic violence. Law enforcement responses. There is violent victimization in Indian country. Rhetoric offers the notion that more violence occurs within reservation communities. True, and they are involved with intoxication. A majority of the domestic violence cases do involve alcohol intoxication. Actual prevalence is not any different than non-Indian communities. Tribes are taking steps to prevent it and restore order and give the victim a sense of justice. Move to the next one. Victims of crime are encouraged to participate in cultural and spiritual activities in an effort to restore their spirit, likely to have been harmed by violence. Victims are also offered substance abuse treatment. Informal counseling, such as engaging in cultural practices, such as beading and sewing, is a common form of comfort offered to female victims. Also given opportunity to participate in the legal proceedings against the offender, shown to have a healing or justice effect on the psychological well-being of the victims and their families. Go ahead to the next slide. For the offenders, usually incarcerated depending on the severity of the offense, face trial in tribal or federal court or both. Substance abuse is significantly associated. Offenders are ordered to attend substance use treatment. I work on the Crow Reservation now. I direct their recovery program now, and I go to court. Couple times a week I go to court, and that's where I get a lot of my referrals for my treatment program. And I would say there is a good number of domestic violence charges that come through there. And I know this is happening back home where I'm from. It's good to suggest a culturally based rehabilitation program, helping them to believe that they are helping in the ending of violence is what matters. You know, some of these men realize that what they are doing is not right, and they do want to change. And one of the men who early in my career that I was most impressed with was Don Coyhis. He talked about his own self when he did training on our reservation and how he used to be someone who not only used substances, but had, you know, domestic violence issues in his past. But I really felt that him being able to acknowledge that and share that was real helpful to the men that attended our treatment programs. You can go to the next slide. Drugs and alcohol. There is a notable overlap of drugs and or alcohol in cases involving domestic violence. And drug and alcohol contribute to the impacts of violence. As disinhibitors, drugs and alcohol, especially alcohol, contributes to increased levels of violence. With rare exception, drugs and alcohol do not cause domestic violence. Consider exploring behaviors that happen only in private or primarily in private, and some simple logic. Go to the next slide. Victims are often coerced into using drugs and or alcohol by their partners. Drugs and alcohol are a way to escape the nightmare of domestic violence. Batterers can gain an increased level of power and control over the victim if they become hooked, especially if the batterer is their connection. And I do not know how many times I have encountered women who have disclosed that information to me. We can go to the next slide. Batterers will often use the excuse of being high or loaded to justify their abuse, saying they wouldn't have done it had they not been under the influence. Batterers will at times get the victims high, knowing their victim won't call the police while they're under the influence. This can be a circular pattern. Re-engaging in a power and control dynamic can trigger relapse for victims in recovery. Relapse can make victims vulnerable to re-engagement in a domestic violence relationship. Some risk factors for substance abuse: abused women are at an increased risk for substance abuse. Spousal abuse scores are the highest predictor of alcoholism in women. Interpersonal violence during the first year of marriage is highly predictive of heavy episodic drinking a year later. So right after they get married, if there's some domestic violence, there's a good chance that victim will turn to substance use. And interpersonal violence is a new term. Being in the field, lots of words that are commonly used are changed or created as time goes on. So the new word here is interpersonal violence. So I'll probably use both of these throughout the rest of this. Women experiencing abuse are 2.6 times more likely to use tranquilizers, sleeping pills, or sedatives. 3.2 times more likely to use antidepressants. 2.2 times more likely to use prescription pain pills. So if you well, back up, just stop for back up. Just think about that. Of how much pain these women are in, or the victims are in, to turn to substances, to want to go to sleep, to be sedated, feeling depressed, and pain pills. Like, they're hurting. These people are hurting, and they have to find ways to learn how to cope and better care for themselves, and realize that, you know, there's ways to get help and get out of that situation. And there are ways to help families. You know, I don't always think that some domestic violence situations have reached a point where we have to break up a family, and people can work together to change. We can go to the next slide. 59.1% of women who screened positive for drinking problems experienced interpersonal violence in the past year. So a good number of women that have come into treatment, you probably want to check their background for interpersonal violence. A lot of times we need to pay special attention when we're doing intakes with these people that we're working with. We can go to the next slide. Women who are physically abused during pregnancy are 7.8 times more likely to drink while they're pregnant. And I have heard stories of women giving birth to children while they were intoxicated, but I don't know that anyone actually really thought to think, what was that woman going through? You know, now when I read these things and I think of those stories that I've encountered in my career, was, you know, I hadn't even given it any thought that maybe she was in a severely domestic violence situation. We can go to the next slide. Interpersonal violence and substance abuse, male perpetration of interpersonal violence and alcohol abuse are linked. Next. Perpetrators are 2.5 times more likely to report heavy drinking, 4 times more likely to report illicit drug use. Next. Dating violence. I have a lot of friends who have teenage daughters, and I cannot believe some of the stories that I've heard lately. Adolescents reporting dating violence are more likely to consume alcohol, smoke tobacco, use drugs, and have suicidal thoughts. So these young teenagers out there today are encountering young adolescent males who are already engaging in dating violence. So we have to be mindful of what our children are encountering as they go out and experience the world. We can go to the next slide. Dating violence perpetrators, male and female, are more likely to have their first drink before they're 13 years old, have been drunk in the past 30 days, and have also used marijuana in the last 30 days. Some special considerations for male victims. Men who reach out for help face obstacles that women don't face, such as level of full service for sheltering. We don't have shelters for men, or I probably haven't even thought about it because most of this occurs with females as the victim. There's a lack of service for males, skepticism, and attitudes about being men. Go to the next. Back up real quick. Did we miss something? Okay, go ahead. Sorry. Law enforcement response does not always look at altercation in same-sex relationships as a domestic violence. So these are some special considerations of same-sex relationships. Like I said, I've been in the field for 20 years now, and I have seen it all. I have encountered lesbian relationships and gay relationships where there has been domestic violence. And usually where I've encountered that is in the substance abuse setting. This is where this has been disclosed. And so this does occur in those relationships. So it does have impacts on safety, impacts on services, impacts on protective orders, and impacts on interventions. So even though they're in a same-sex relationship, they are still dealing with the same issues. Can go to the next slide. Other special considerations are looking at mental illness. Seriously mental ill are more susceptible to victimization. They are often very dependent on their abusive partners. Some of these women just have a lot of problems with day-to-day functioning, and their perpetrator is very aware of that they can control that person. They are often not believed or maybe blamed when they disclose the abuse. Perpetrator behaviors are often perceived as being understandable versus power and control. Next. We also have elder abuse that involves physical violence, psychological abuse, material abuse, the misappropriate use of personal items, active neglect, passive neglect, and sexual abuse. Some risk factors for elders is living in poverty, changes in kinship systems, their poor health status, negative effects of technology, changes in values, and lack of interest in the elderly by the young. I often hear so many elders even in the tribal community I'm in now, the young people, don't have no respect, and they're not taught to respect our elders. Like we should treat them with the highest respect and do everything to make sure that they are safe and all of their needs are met. We can go to the next slide. Some protective factors for our elders is teaching our children to respect the elders. culture of mutual dependence and respect, that we need each other, strong extended families, deep tribal cultural customs, optimism and contentment derived from deep sense of spirituality. Our elders have a lot of wisdom to share with us. Ritualistic and religious practices. Disrespect of elders is a very serious matter. To the next slide. Some philosophical differences. Many natives see domestic violence as a result of a lack of attachment to their specific culture, witchcraft and sorcery, and abuse of drugs and alcohol. People would be more involved in their culture, stay away from those who practice bad medicine, and cease drinking and drugging. There would be less violence in tribal communities. And the last time I went home, I picked up the Wind River newspaper, and I was shocked to see like 2 or 3 domestic violence cases in the paper. That I think one was a headline, and then there were a few more inside of the paper. And then when I looked at the ages, these were young people. And I always, whenever I hear something bad's happened back home, I always have to ask the question to myself is, I suppose drugs and alcohol were involved. And sadly, that's where most of the bad things happen, is alcohol and drugs is often a part of that. The next slide. Restorative justice. Australian Aborigines, Canadian Aboriginals, New Zealand Maoris, and other various indigenous cultures practice restorative justice, but there is no sound data. Both perpetrators and victims report that once substance abuse issues are resolved, violence decreases. Also, as perpetrators age, they report the tendency to reduce or cease violent behaviors. Go to the next slide. A lot of understanding is needed. The U.S. Department of Justice Office of Violence Against Women is working diligently to support research in this area. Due to a lack of interest in this area by qualified and competent research scientists, the data that are produced may be just as flawed as the data that currently exists. A lot of funding distribution is in the form of grant programs that allows the Department of Justice a way to gather data. Next. Evil spirits involved. Many report this is to be associated, and I just put that out there. I've never heard of that myself, but I know there are people that this is a strong belief for them. So we don't want to disregard their feelings. To the next slide. Physical abuse can be battery. It's a pattern of abusive behavior that keeps a person fearful for their safety. Can include withholding food, water, and shelter. There is also physical control, such as restraining, tying up, handcuffing, blocking, locking in, taking car keys, or even clothing and shoes. Next slide. Some objectives we'll cover is discussing domestic violence, the prevalence, potential causes, cultural responses, and the problem conceptualized. I am sorry, the slide is out of order. So if we could skip over this one, Steve. I need to.
We'll move that one back to the beginning.
Yes.
Yes. Okay. Maybe this was just a refresher of what our objectives were.
Well, I added the substance abuse stuff in. So.
Yes, that's true. We'll move it around. Thank you.
Okay, more on physical abuse. There is hitting, punching, slapping, tearing clothing, breaking eyewear, spitting on, biting, burning, hair pulling, throwing objects, and cutting. And yeah, very horrible. When I was telling you about the adolescence of my friends, my friend would not have known if her daughter had not come out in shorts and a tank top, and she saw some marks on her body. So they tend to abuse, especially in adolescence, in places where it's not going to be seen. And her mother had questioned what had happened. And of course, she knows what I do for a living. So sometimes I'm the one that they call first. And I had to help them through that situation. And it was a very traumatizing experience for my friend's daughter that I think of as a daughter. And I suggested that they go and get some help, and they did. But yeah, this is a teenager, you know. There's threatening with a knife, gun, or other weapon, drugs and alcohol by force. Some women are forced to use substances. Go to the next slide. There is psychological abuse, also known as gaslighting. Convincing a person that they're worthless, hopeless, without help, powerless, and under the control of the abuser. Threats of harm to the victim, their children, or their loved ones. Stalking to the point of feeling very fearful. Manipulation of facts and ways of perceiving the truth. The next slide. Sexual abuse can involve rape, sexual coercion, forced viewing of pornography or other sexual activity. And I've often heard men say that, oh, if you're married, that it's not rape. And what the law says, if a woman says no, she means no. It does not matter if they're married. That doesn't mean that the man has a right for that. The next slide. There's also the threat of control of children, providing false knowledge of how they could take the children legally. Threats of leaving the area or the country with the children. And we all see these Amber Alerts sometimes, and the male has run off with the kids, and that's domestic violence, and threats of harming the children. The next slide. Emotional abuse, magnifying the victim's insecurities, insults in public and private, degradation of their character, and giving messages that are not consistent. Next slide. Financial abuse, maintaining tight control of money, withholding the truth about finances, exploiting finances of an elderly or a dependent adult. The next slide. Isolation, a total lack of autonomy, not feeling that a person is free to make their own decisions and own choices. Tight control over who can be seen, where, and for how long. Convincing them they belong only to the abuser. We can go to the next. Intimate partner violence. 1 in 3 women and 1 in 4 men have been victims of some form of physical violence by an intimate partner. 1 in 5 women and 1 in 7 men have been victims of severe physical violence by an intimate partner. The victim, most of them are women, children, of course. Sometimes children try to get in the way to protect their parent and they get hurt. And people don't stop to think that children are traumatized by this domestic violence. So they're still a victim, no matter how you look at it. Men can be the victim, and they come from all ages, education levels, ethnicities, socioeconomic levels, cultures, and religions. The victim continued. Some risk factors could be low self-esteem, poor support systems, They are dependent on others for day-to-day living. They have a lack of coping skills, and they're not aware of resources that are available to help them. Next. The victim often wants the abuse to end, but not the relationship. So a lot of times, we all want that house with the family and the mother and the father and the children. And so they hang on to that relationship despite the abuse. They may feel isolated, may be depressed, can act helpless, and feel embarrassed. It is something that's embarrassing. The victim continued, again, they fear judgment and stigmatization of what are people going to think about me. They may deny and minimize the abuse. They still love the abuser. They may be emotionally withdrawn and distances themselves from their family and friends because their family and friends know that things aren't going so well and probably told them that they know it's not going so well and they don't want to hear that. So they'll isolate themselves from their family for that reason. They will feel guilt and shame, be highly anxious because they never know what's going to happen next. They're walking on eggshells in their home. They may have suicidal thoughts or attempts, abuse drugs and alcohol, and of course, they're going to always hope that the abuser will change. For the abuser, the main objective is domination and control. This often occurs in cycles that includes good times and peace, followed by periods of abuse. Their patterns of abuse intensify as time goes on and the abuse escalates. So it may start out over a long period of time where the relationship is going good, then there's some tension building up in the family and could go for weeks, maybe over a month or two, and then there could be some abuse. But as the cycle continues, after the abuse is that honeymoon phase, and then that's where the woman is like, oh, this is when he might buy flowers and be extra special nice and give her all the attention and apologizes profusely. And that's what they really want in their relationship. And the cycle gets shorter and shorter. So the time gets shorter and shorter and the abuse gets more severe. 90% of the abusers have no criminal records and are law-abiding citizens because they're not always reporting this. Next. There is no one typical detectable personality of an abuser. However, they do display some common characteristics. An abuser often denies the existence or minimizes the seriousness of the violence and its effect on the victim and other family members. An abuser objectifies the victim and often sees them as their property or sexual objects. An abuser externalizes the causes of their behavior. They blame their violence on the circumstances, such as stress, their partner's behavior. She wouldn't be nagging me so much. Oh, I had a really bad day, or it was the alcohol or the drugs, anything but taking responsibility for what they have done. An abuser has low self-esteem and feels powerless and ineffective in the world. He or she may appear successful, but internally they feel inadequate. Next. The abuser manipulates to appear loving, caring, and attentive, especially in the beginning and also during the good times in the abuse cycle. In public, they are often charming, successful, and well-liked. They appear attentive and devoted to their victim's family and friends. They put on a really good show. And nobody knows. The abuser is often extremely jealous and possessive, blames the victim for causing the abuse, might be cruel to animals, is extremely controlling, rigid in beliefs about women and children, like the women should be at home cleaning and taking care of kids, and they don't see a woman as being someone who should have a career and being successful in life. And this is the abuser that I'm talking about. We can go to the next one. They may be particularly interested in guns and weapons. They may be forceful, domineering, and aggressive, may be highly vigilant, and of course, they never assume blame. It's not their fault. The victim's reaction to this abuse: coping, placating, and enduring. So they learn to just go through it thinking that this is how it is. Managing, anticipating the abuser's mood and modifying their own behavior so that they don't arouse anger, and also diverting attention. Resisting, creating consequences such as arrest, seeking outside help, hitting back, or striking preemptively. Domestic violence affects all aspects of a person's life. It affects their job, if they're going to school, their home, everywhere they go. It affects the entire family, and it affects the community. Okay, go ahead. Resistive and reactive violence. The target is the abuser, used as a means of stopping the abuse or escape, a form of revenge or retaliation, seen as a way to reclaim or restore dignity. So this is when the woman is starting to get tired of being hit on, being controlled, being put down, and decides that, I'm not going to take this anymore. It's time for me to fight back. Next. Resistive and reactive violence continued. The perpetrator has the key to their own protection by stopping their violence against the victim. Violence is rarely the first or only tactic used by victims. So they may try other things. They may tell them that they need to stop, or they may tell them that they're going to leave if they don't stop. So they will try things before they reach a breaking point. Next. Primary or other tactics used by victims might be negotiations, and appeasement, threats to withdraw from the relationship, soliciting help from others, threats to expose the offender to others, threats to hurt the offender in some way. Violence by both partners. The victim's use of violence ends when the abuser's violence ends, when the relationship ends. The abuser will continue to abuse indefinitely and often more intensely as they feel the loss of control over the victim. either within the relationship or when it ends. This is when the victim is in the most danger. Statistics: on average, nearly 20 people per minute are physically abused by an intimate partner in the United States. During 1 year, this equates to 10 million people. On a typical day, more than 20,000 calls are placed to domestic violence hotlines nationwide. The presence of a gun in a domestic violence situation increases the risk of homicide by 500%. Intimate partner violence accounts for 15% of all violent crimes. Women between the ages of 18 and 24 are most commonly the victim. 19% of domestic violence involves a weapon. Domestic victimization is correlated with a higher rate of depression and suicidal behavior. Only 34% of people injured by intimate partners receive medical care for their injuries. Only 34%. So there is a big number of victims out there that are hurting in private. They are treating their own injuries and not going and getting help that they need where they could be screened. So maybe they are afraid to let someone know, because then, I think the abuser may not want them to report it either. To the next slide. Rape. 1 in 5 women and 1 in 7 men in the United States have been raped in their lifetime. About half, 46.7% of female and 44.9% of male victims of rape in the United States were raped by an acquaintance. Of these, 45.4% female and 29% male victims were raped by an intimate partner. This is someone they know. Stalking. 19.3 million women and 5.1 million men in the United States have been stalked in their lifetime. 60.8% female and 43.5% male victims of stalking were stalked by a former or a current partner. Homicide. A study of intimate partner homicides found that 20% of victims were not the intimate partner, but family members, friends, neighbors, persons who intervened, law enforcement responders, or bystanders. %72% of all murder-suicides involve an intimate partner. 94% of the victims of murder-suicides are females. Children and domestic violence. 1 in 15 children are exposed to intimate partner violence each year in the United States. 90% of these children are eyewitnesses to the violence. Children who live with domestic violence are at an increased risk to become direct victims of child abuse. Next. Next. Children's reactions to domestic violence. They can experience generalized anxiety, have sleeplessness, have nightmares, difficulty concentrating, high activity levels. So those of you that are working with children, maybe even teachers, need to be aware of children that are having difficulty in school, because this could be something that might be going on at home. The children's reactions may include increased aggression, regression to separation anxiety, intense worry about the safety of a parent or their own safety. Next. Long-term effects on children, especially from chronic long-term exposure to family violence, could be a physical health problem. Behavior problems in adolescence, such as juvenile delinquency, alcohol and substance abuse. Emotional difficulties in adulthood, such as depression, anxiety disorders, and PTSD, according to the National Child Traumatic Stress Network. Next. Domestic violence poses a serious threat to children's emotional, psychological, and physical well-being, particularly if the violence is chronic. Children may learn that it is acceptable to exert control or relieve stress by using violence, or that violence is linked to expressions of intimacy and affection. The economic impact. Victims of intimate partner violence lose a total of 8 million days of paid work in a year in the United States. The cost of domestic violence exceeds $8.3 billion per year. Between 2003 and 2008, 142 women were murdered in the workplace by their abuser. 78% of the women killed in the workplace during this time. So if you look at that time period, like I said, the information that I find tends to be dated. Between 21 to 60% of victims lose their jobs due to reasons stemming from the abuse. Sometimes they're jealous of their job or people at their job, and it may force them to leave their job, and they'll do it. Next. How can we help? We need to encourage and support the client where they are. Do not pressure them to leave. Give them resources and education. Next. Here are some resources: the National Coalition Against Domestic Violence, the CDC, the National Child Traumatic Stress Network, the National Domestic Violence Hotline. And are we at the end of the slides? I think we are. You can go to the next slide.
We've reached the end, Avis.
Okay, for some reason, I'm thinking I had more slides than this. What I was talking about was, and I'll just talk, screening for trauma and domestic violence. And I've presented domestic violence in my treatment programs myself, and I've even had couples sitting together in the program together, and I've had them actually come up to me and ask to, to get counseling together, because she'll say, he is doing some of that stuff, that you said right there. He does that, and pointing that out in front of everybody. Some of these women are very bold and very brave nowadays. But getting them help. There is research that shows that getting these men screened and into treatment, and I often see a separation of these people come into drug and alcohol treatment. And like I said, I sit in the courtroom, and I've been involved in treatment for a long time and know that several people get referred for domestic violence charges that often involves alcohol, or they wouldn't be referred to us for drug and alcohol treatment because most judges require them to get a drug and alcohol evaluation. And there is research that does show that getting help can really help these people. I have seen people work on changing their relationship and learning communication skills. And with women being more open to disclosing and catching it on the front end of the screening process and asking those important questions to these women that come in. Like I said, they are at a higher risk to use drugs and alcohol. And when you get to talking to them, they may be more open to disclosing that a lot of their use was related to being in an abusive relationship. And early on in my career, I was a counselor in a residential treatment program. And one of the programs that they use that is still out there, I highly recommend, I use it myself, is Lisa Najovic's Seeking Safety. You can get this book off on Amazon and it's really cheap. It's not very expensive. But when I worked at Southwest Counseling in Rock Springs, Wyoming, we created a group for women. And we used the whole book. And it was really awesome because it also teaches these women coping skills. And it was really good to get them talking about, realizing that they were in a relationship and working on themselves, of increasing their self-esteem and looking at what their relationship, what it was, and that they're, you don't have to be in a relationship to be okay, to be a whole person. And as time went on, we were like, I think there was a time when we needed something to do with men, and we put the men in there. And it was really a surprising reaction that the men were really open to sharing that I did stuff like that. I abused my girlfriend or my wife, and we decided to create a men's group. And as far as I know, they still do offer the Seeking Safety for the men as well. And I myself incorporate domestic violence work into the work that I do, because I don't see these as something that we separate of, oh, we got to send you to another program. You need to go get help someplace else, when this can be done together. I am in the process of bringing the domestic violence program in collaboration with my substance abuse treatment program here in Montana. And I think that that is very important, because I shared with you all that my mother was a victim of domestic violence, and she struggled with alcohol problems. And so that just makes it more confounding, more traumatic. So we have to be able to treat both of those issues at the same time. And that is why I'm choosing to bring that under my umbrella, so to speak, and provide domestic violence in combination with substance abuse treatment where I'm at. One book that I picked up recently, like I said, I'm always doing research. It's called Trauma-Informed Treatment and Prevention of Intimate Partner Violence. New book. I think it might be a good one for people to check out. I've included some handouts with this presentation today, and one of them is a tip from SAMHSA that looks at substance abuse and domestic violence treatment together. Great free resource. You can download it right off of the SAMHSA website. I highly recommend it. I also downloaded a book that I found in my research online, and it is called The War Against Domestic Violence. Again, outdated, but very good book. Some of the presentation that I gave today is taken from a couple chapters of that book. There is a chapter in there specifically on Native Americans and domestic violence, and there is a chapter in there on substance abuse and domestic violence. So I pulled those out of there. And I also added a safety plan. when you're working with these women, you do want to help them create a safety plan. And it gives them a sense of control and feeling like they're taking action. Or if it's a male, like I said, we have to look at that this isn't just women that are affected by this. And maybe even children, if you're working with children, is creating that safety plan of what are you going to do to stay safe, keep your family safe, and how are you going to take care of yourself, who you going to call, where you going to go. And I've been told some of these people will leave that relationship several times before they finally leave, and that time they actually make the decision to leave is one of the most dangerous times for them. So I think it's important that we don't be afraid to ask those questions on the front end of drug and alcohol treatment, and making sure that we educate our staff to it. And a lot of these women, I notice, don't tell you right away, but when we do these presentations, they're the most verbal ones in the room of, yeah, he did this to me, he did that to me. And usually some of these women have been in more than one relationship like that. Sadly, I encountered a woman not too long ago, and she said, all men want to do is beat me. And I was like, oh my gosh, here's somebody who's got severe trauma. Like I said, they don't tell you on the front end. I think when they get more comfortable and have more sobriety time, they start to open up more and realize that they have some issues that they need to address, which is why I recommend that seeking safety, but also being trauma informed, knowing that a lot of our people are hurting. And I don't necessarily think families need to be disrupted. I think if we can catch this problem early on, we can get some help for that family and work with them on communication skills and coping skills, and being willing to work on themselves too, if they're interested in working on their own family. I think that's
great, Avis. Thank you so much. We do have a little time, and this worked out really nice because I'd like to open the floor. I see Donna has her hand up, so we can open the floor now. Avis can take questions directly, or we've had a lot of comments in the chat as well. But let's open the floor now. Donna, you had a comment or a question?
Yes, I did. We know, thank you, Avis, for this very nice presentation. We know that few women will admit to the domestic violence. They don't want to bring it up, or even if you question them, they'll say, oh, no, I'm safe at home. But are there some tips that you might be able to give, some gentle questioning that might help to uncover it, things to look for? I mean, we know about wearing long sleeves when it's 95 degrees outside and things like that. But, hey, I see you have some pretty heavy makeup on. Sometimes when I see people wearing heavy makeup like that, it's to cover up bruises, or are there other things that you could suggest that might help people to help somebody feel safe to admit that they're having problems with intimate partner violence? Other things like behaviors or whatever. Isolating, they're not attending family functions anymore, some different things like that people might want to be aware of.
Like I said, the screening on the front end there, if you look at that book from SAMHSA, there is some screening instruments in there that has some questions that you can ask. Now that you bring that up, when this COVID hit, I was still working in Cheyenne, Wyoming, where I was running a nonprofit drug and alcohol treatment program. And we had to go online. We went to Zoom, and we were running a women's group. And one of the women didn't want to put her camera on because one of the rules was you need to be visible in the group online, like at least a majority of the time to get full credit for your group participation. So we had to continue providing services regardless of the COVID situation. And for safety, we went to telehealth, and one of the ladies did not want to put her screen on. And, you know, I didn't think at that moment of why are you not putting your screen on, but the little chat box that we have here, she put on there that a message to me that she would talk to me about it after the group. And so when the group was over, I asked her, you know, what was going on? Is she okay? And she said, I'm going to show you what I look like. And she put herself on the camera, and she had been beaten. And her face was pretty bruised. And it was so hard for me to see her like that. And I'd asked her if she'd called the police, and she said, yes, the police were involved and things had happened. And she was kind of really stressed out. Again, she didn't go to work because she was badly bruised up. And I offered her to come in if she wanted to come in and talk to someone. And she was all caught up in that situation. And when she felt better, she actually came in, but she got caught up in that honeymoon phase. And we're doing really good now, and things are better. And I continue to educate her on domestic violence in that situation of I see you being in this situation. And she did the whole thing of, you know, justifying and minimizing, and we watched her go through that for quite a while. But you know, I didn't think at that time, and I didn't want to embarrass her in front of everybody. I mean, she was trying to participate, and she did open up afterwards. So we don't often think to check in with them later while they're in the treatment program, because she had been with us for a while when that had happened to her. And I didn't realize that she was in that kind of a situation. And it wasn't my group always to run. I was actually getting my staff comfortable with using the Zoom, because a lot of them had never used it before. So I was that day was like, you know what, I'll just do the group and you'll see how I do it. And then you can take it from there. And I use this as one of my examples because I've done some of the telehealth trainings for this program as well. And I talked about, you know, when people don't want to be on the screen, you might want to be like, you know, asking those questions in a, I guess, a calm, caring way to let them know that you care about them and you want to help them. And I don't have the exact wording. I do know the Seeking Safety has some really good information in it. And that book from SAMHSA that I have attached to this as a handout has some really good questions that you can ask as well, because there's also screening questions for the victim. And a lot of those questions in there are really good. And, you know, had I thought about that, I would have included them in this presentation, but I'll make note of that.
I had put in the chat too, we will send with you some of the handouts that Avis has included. We'll send those to you all in the follow-up email. Make sure that you can have access to those. So I put that in the chat. I thought I would mention it. Thank you. We have a few minutes. Other comments or questions? I know there's been a lot of activity in the chat. I'm not even going to attempt to try and go back. There's just a lot of activity, a lot of great comments, really insightful, really interesting comments. But I wanted to open the floor. We have a few minutes left before we conclude today's broadcast. So other questions or comments or thoughts for Avis?
I'm scanning through the comments in the chat box.
If I could, Anine, my name is Teresa Subral, Chinakazit, Okichitakwe. I'm Anishinaabic and I'm an Menominee descendant.
Okay.
And for my life, I've been in this. And
Okay.
I'd hope you could do maybe a part 6 of this and talk about solution based, because we need some training. I think a lot of it stems from the impacts from the soldier forts and down to the trading post and then to the residential schools and the orphanages. Learned behavior, generational cycles of dysfunction, and this desensitizing or normalizing of. And then through that, we've lost a lot of our morals, our values, our family, our systems. And we suffer then lateral violence, because the rates you're talking about, the statistics you brought up, this is such an important topic. It hits home in every way in Indian country, you know, even in the city portions, because we carry that with us, right? And so, you know, we're looking at lateral violence at the workplace because this is normal how we communicate and we behave, or we're venting from what we've been dealing with at home, to our children who are in these relationships at very young ages. What I see in our communities, it's horrendous. But then it's being broken down as just rape or just this or just that. But where is it coming from if we go to the root issues? You know, and it starts at home. So what you're covering is huge. It is the root issue, I think. And to look at maybe some solution based, how do we change the family dynamics? How do we change how we communicate and behave at work? What is normal? What was culturally how we, you know, responded and acted with each other? And then in relationships, what we do and don't take, and as friends, and how we carry ourselves. And like you said, the safety plan is so important, but how do we carry that through our lives as a safety plan, as a sibling, as a student at school, or our kids, you know, because of the bullying? And that's coming from, what do they see at home? And that was domestic violence. So, and then it's normalizing it. But yet we're all crying out because none of us want that. None of us want it for ourselves, for our kids, for our siblings, our moms, our dads. We don't want that, but we're normalizing it. So maybe trainings and what we can bring in to the youth centers, to the elder center, because like you said, elder abuse is huge. And because the elders, how they were raised and what they're facing and the resources or lack of them. Thank you.
Thanks for bringing that up. Like I said, I realized I was in a domestic violence situation, although it wasn't physical, it was the psychological, the mental, the financial. And I myself at a very young age thought domestic violence meant you're getting hit. You know, if somebody's beating on you, that's abuse. My husband at the time didn't drink or use drugs. So I always thought, you know, well, he don't drink or use drugs. So that was my reason for staying in that relationship and not knowing why I was feeling so horrible was that was domestic violence, but I hadn't been educated to that at that point until after I had left that relationship and lost my own mother to domestic violence and got domestic violence training myself. And so as I was sitting there going through the training, I was like, oh my God, no wonder why I was feeling like crap in that relationship. But when I lost my mother the way I lost her, I promised myself I would never let a man lay a hand on me, never. And I seen my grandmother go through domestic violence. I never seen her get hit, but I was raised by my grandparents because my mom struggled with alcohol. My grandmother never drank, so I'm sharing about myself. And I would ask her why she would tolerate my grandpa doing some of the things that he did. And mind you, he would be under the influence of alcohol when he would do some of the things like he did, like take the phone off the wall or try to throw the furniture out the front door, the living. See, I saw this growing up. And so we may tend to normalize culturally where we come from of this is what the normal is. And I remember being in a relationship where I put my kids in the car at night because my partner at the time came home intoxicated one night and was being really aggressive. And so I put the kids in the car and drove home, only for my grandmother to talk me into going back after he sobered up and said he was sorry and whatnot. And so it's just, that's what men do kind of thing, you know. When I was young and I had kids to take care of, so I was like, okay, you know, grandma knows what's best. And so, you know, I'd put the kids in the car and we would go back home. And it was me being able to realize that, you know, I don't want to be in that situation. I don't want my kids to see stuff that I went through. So it's us breaking those cycles ourselves and knowing that, no, we're not going to live like this anymore. There's options, which is why I got into the profession that I'm in. Is I wanted to break all those cycles, like alcoholism, suicide, domestic violence. A lot of that's in my family back. And me being somebody that likes to read all the time, I did do research on my own people to discover that domestic violence was something that happened back in the days before we were still living in teepees. And if you really looked at it that way, so that to me was very hard, because they say, oh, the women did all the work back then and the men just, you know, just did hunted and kept people safe. And I thought, wow, these women were really, I mean, they were in that situation where they had to do all of that. And I think, like I said, it's educating, like in the schools. So I just posted something on social media recently, and it talked about that we should be teaching mental health in our schools to our kids about coping skills and depression and all the kinds of problems that we're having, that they need to learn this at a young age. Because my friend's daughter I shared with you about, I was shocked. And being on the reservation, when my friend tried to confront that family, they like were ready to use violence against my friend, because she went to that family to tell them what had happened to her daughter, and their reaction to her was not good. And right now with this COVID situation, I feel like law enforcement isn't really enforcing the law. And I see that here where I'm at now, and they say, oh, there's only 4 police officers. So 9 times out of 10, there's 2 on duty. And so I'm like, how sad is that? Why do we not fund more law enforcement? Like that should be your number one, where money is going to keep our communities safe. And I just feel like even back home, which is different here, I'm living in Hardin, and the Bureau of Indian Affairs jail is here in Hardin, and it's huge. And I'm from the Wind River Reservation, and our jail is really small, and we don't have places to put people, so they're just constantly turning people out the next day. Boom, boom, boom. Give them fines, send them out the door. What are we doing to get these people involved in treatment programming? You know, are they referring them to domestic violence programs? Where I work now, sitting in the courtroom, I'm like, why don't we have well, back home we called it a drug court, their healing to wellness court. This tribe has never had that. And so I'm looking at getting this tribe one of those federal grants so that we can create a program that is funded that will address, maybe I can call it a family court, where we get these cases and we start helping them. Because like I said, research shows people can get help and they can get better. I mean, we can help these people. They don't have to tear their whole family apart. If they want to work to make it better, I believe that they can. And if we put those cultural pieces in there, back home at the Shoshone Recovery, the sweat lodge is like amazing. I love seeing the families come as a family. The mom might be the stepdad and the kids, but they all come together and they interact as a family. They participate in the sweat, and then they have the meal after. And just to see them interacting and being happy and enjoying that just like made me feel really good. I was like, this is good. And I think that part of it and bringing them back to their cultural roots and practices is key to like all healing in our tribal communities. But you're right. A lot of these people need a lot of trauma work. To do drug and alcohol work, you have to know how to treat trauma, because it just comes along with it. Our people come in bad shape, they're hurting. And some of these people that are perpetrating, they're coming from that environment too. Like you said, it's in the family. They learned it somewhere. They saw that. So for them, yeah, dad controlled, grandpa did this and that. Like I saw that. And, I told my kids, I said, I changed my the way I do things and live my life, because I didn't want you to see what I saw when I was growing up. I saw my mom get involved after one relationship to another, to an abusive partner. I saw what happened, and they say it really does a lot of damage to kids. The ACE studies. When I first saw that, I was like, geez, I could check every box on this list. That's how affected I was by that, and didn't even realize it. But I like to tell people that education is probably our greatest protective factor, that the more educated we get in our communities, the better off our people are going to be. I did my dissertation study on 4 successful men from my tribe that graduated from college at the University of Wyoming, where I graduated from. And the characteristics I had from these 4 people that I picked out of 6 or 7 of them to really narrow my study on my own people was they came from 2-parent families. Every one of these guys had strong mom and dads involved that didn't use drugs or alcohol. These guys did not use drugs or alcohol. One had been in recovery for several years. And it was that strong cultural belief. They all participated in Sweat Lodge and Sundance and all of our cultural things. So that for me just really gave more meaning to, those are the things that we need, that are really proven by my own work of these successful people came from these really good homes, which was completely opposite of mine, to hear them talk about how good their mom and dad was, that their parents stayed together and didn't use drugs and alcohol and practiced our cultural ways. Just made like, I had to get that information out there. I still share it with people that if we live this way, we can have these good things. Our lives aren't all bad. There are people out there that are good. A lot of the research that I read when I started my research was everything was really negative and not done by natives. We need more natives doing native research and doing tribal specific research.
Oh, Avis, I wish we had more time, because this is fascinating, and I know I want to just say to everyone, we really appreciate your attendance here today, and I think I safely speak for Donna and the rest of our crew. We really do appreciate everyone signing up and attending today, and want to just remind everyone that we will broadcast again next month. I believe our topic next month is going to be on opioids, fentanyl, and overdose. So please join us for our January broadcast. Should be the first Thursday of January, I think, if somebody can get me a date. But yeah, we'll make sure we have a flyer out and spread the word. Invite your friends and colleagues to join us, and we'll continue to have this discussion. I also want to remind everyone that we will send out a follow-up email that'll include a PDF copy of this presentation, along with some handouts that Dr. Garcia has for us that you guys can use. accordingly. And then we will also ask that if you would like CEUs, we can offer 1.5 CEUs for today's broadcast. Either you can specify either substance abuse or NADAC approved CEUs, or if you need social work. Those are the two we can offer. So just let us know and we'll prepare those certificates and get those out to you. Then you're free to have the handouts as well. So again, I want to thank everyone, especially Avis, for joining us and sharing both really good information and some really personal information too. And I think we should honor that, her stories, and keep them here with us today. So Avis, you touched my spirit, and I've known you for a while, and I didn't know about your mom, so that really moved me. And I want to thank you for making yourself vulnerable to us and sharing that. So,
yeah, I was very young when that happened, so it took me a lot of years to get myself where I'm at, that I can talk about what's happened in my own life, and that's the reason I continue to do what I do.
Yeah, I can relate, and I want to thank you for that very much. So
thank you, Avis, and thank you everyone for coming. Yes.
Thank you, Donna.
Yeah.
Thank you, Avis, Jeff, and all of you that attended today. Look for our follow-up and request your CEUs, and we'll get those out to you as soon as we can. So
don't forget your self-care.
That's right. That's
True.
right. Until
Good
next
reminder.
time, everyone, please stay safe, stay healthy, and stay connected. And we'll see you in January. Okay. Bye.
Bye.